So hello and welcome. My name is Dana Kramer. I'm one of the project coordinators at the Rural Health Initiative. The mission of RHI is to engage partners and share ideas and expertise to support communities in improving health while stimulating a higher level of wellness across the state. So thank you all for joining with us today. I really appreciate it. We're going to be having a webinar called Alzheimer's Association Resources and Support. It's going to be presented by Whitney Thompson, who is the Director of Programs and Services at the Alzheimer's Association Montana chapter. So a few quick technical details before we get started. I've set all of your lines to mute to begin with. So if you wish to ask a question during the presentation, please just unmute your line and you can do so. You can also submit questions in the chat box at the bottom of your screen during the presentation, and Whitney will address them. At the end of the presentation, we'll have a quick question and answer session, and at this time, I'll unmute all of the lines. Once the webinar is over, you'll have the opportunity to provide valuable feedback for RHI through a brief survey. I'll be sending that survey out via email immediately after the webinar concludes. It only takes about 3 to 4 minutes to complete, and we would really appreciate your feedback on how we can continue improving our webinars. So thank you all again so much for joining us today. I'm gonna now roll the ball over to Whitney and she will begin the presentation.
Thank you all so much for joining today to talk more about the resources that are available for our healthcare professionals at any level. We really wanted to take the moment to be able to connect with all of you, and I highly encourage questions. I want you to get the information that you all need today too. Our agenda, we're going to start the afternoon out together talking about a couple quick stats around Alzheimer's disease, and particularly here in Montana. Then we'll jump into an overview about the Alzheimer's Association, resources that are available for your patients and their families, and then tools that are out there for providers as well. To clarify as well, our title is the Alzheimer's Association, but we really help families that are dealing with any type of dementia, any type of cognitive changes that are happening. And all of our services are available to anyone impacted with any type of dementia. Starting off to ground us in why we're having this conversation, this is a quote from Bonnie, who is living with early onset dementia, and she is here in Montana and one of our national early stage advisors for the Alzheimer's Association. And all of you on the call today know that this is not unique. We have many families that have this same experience, and I am thankful that we are talking today to address these sorts of situations. So Bonnie shares that the diagnosis was devastating. I fell into a deep state of depression and cried myself to sleep almost every night. I was so worried that my grandson would grow up without a grandma. We weren't prepared with questions, and she's reflecting on when she was diagnosed. We were not given any resources or pointed in any direction where resources could be found. The word dementia was not used. And what can we do to work together so that Bonnie and other people like Bonnie aren't faced with this devastating news alone? And remembering that each one of these numbers that we're talking about is a person like Bonnie. Here in Montana, there are over 21,000 individuals living with Alzheimer's disease. And this is only talking about Alzheimer's disease and only talking about people over the age of 65. So it's a very low number when we're really looking at dementia. So this doesn't include Bonnie. And then we also need to look at the 50,000 caregivers in Montana that are helping navigate this disease as well. And how do we support all of them? Many of you might know that Alzheimer's disease is the 6th leading cause of death in the United States. It kills more than breast cancer and prostate cancer combined. And here's a real kicker for our healthcare systems and for our communities. It's going to cripple our healthcare systems if we don't pay attention to it. Alzheimer's and other types of dementia will cost the nation $290 billion in 2019. And we know that with our current treatments and practices that these The number of individuals impacted by this disease and the cost of this disease are only on the rise, with about 1.1 trillion cost as the cost by 2050. Where you all come into play with our patients that we're working with, we release facts and figures where we really go out into the community and see what our constituents are reporting. And they've reported that 82% of seniors say it's important to have their thinking and memory checked, but only 16% say they've received regular cognitive assessments. So there's a disconnect there for us, and how can we work together again to improve that disconnect? One more stat for us today. When we look at diagnosing Alzheimer's and other types of dementia, only about 50% of people pursue a diagnosis. And then on top of that, only 50% of them are told of their diagnosis. And this includes caregivers reporting whether or not they were told of the diagnosis as well. When we look at those 50% being told, we can compare that to with the four most common types of cancer. 90% of people are told of that diagnosis. And we hear a lot because there's nothing we can do. Where are we going to connect families? There's no treatment. What's the point of telling them? But we can't imagine someone coming in with pancreatic cancer and not telling them of their diagnosis, because they deserve that. They deserve to be connected to resources and learn more about what they're dealing with, and let people know what their wishes are for the future as well. Moving into the Alzheimer's Association and how we can support you, I wanted to take a moment for you just to reflect on what you think of when you think of the Alzheimer's Association. And in this forum, I won't have you share. Sometimes we have people that just think of the Walk to End Alzheimer's that we do, or just think of advocacy or research. But we really have a holistic approach to what we do, and we continue to expand that approach. Our vision really is a world without Alzheimer's disease and other types of dementia. I often equate this to cancer. Just a couple decades ago, we would never talk about cancer, and we didn't have funding for research, and we didn't have survivors, and we didn't rally around individuals with cancer. And now we rally around people and we have survivors. We need to do that same thing with dementia. We need to start talking about it. We need to connect people to resources. We need to rally around them so that we can have funding, research, and ways to treat, or even maybe someday cure. So to have that survivor. Our mission, why I'm passionate about working for the Alzheimer's Association, is because of that mission of advancing our research and looking at public policy, but also looking at providing care and support to those that are impacted now. And that's really what we will be focusing in on today. We've touched on that we focus on research, increasing concern and awareness so more people are talking about the disease. We have the Walk to End Alzheimer's around the state. We really believe in strengthening diversity and inclusion, and then as well as advancing public policy. Moving on to our next agenda item is effort supporting your patients and their caregivers. First and foremost, I want all of you to be aware of the 24/7 helpline, 800-272-3900. I have colleagues that are available any day, any time of day, for anyone that is concerned about their own memory, for caregivers, for families, for professionals. We really need to encourage families not to hesitate to reach out to this number. It's free. They're master level care consultants on the other end. And I was just meeting with an individual this morning as a volunteer, and she was talking about the helpline, and she's well aware of the helpline, but then reflecting on how she didn't know the scope of what the helpline individuals can help with. They can answer basic questions, but they can also help families with legal and financial navigation, caregiving situations that can come up. Maybe it's, I feel like my loved one's ready, it's time for them to move to assisted living. Well, what kind of things do I need to look for? How do I have this conversation? Dementia and driving, the list goes on. And this is something that we hear a lot from providers, is how can we work as a team between the Alzheimer's Association and other people in the community, and having this extra layer of support of care consultants that are available any day, any time of day, to reiterate that message of support and that individuals aren't alone. I'd also say that it's available in other languages too, in case you're running across families that English is not their first language. I think that's all with the helpline there. Another thing is individuals that are caregivers perhaps can't leave their homes because they're caring for their loved one. And this helpline is a great way for them to get support in their own homes too. The next support available for individuals living with the disease and their families and other caregivers is we offer free online and in-person education. You can find anything that we offer in person can also be found online too. The in-person support that we have available across the state of Montana, one is community education. We have teams of volunteers throughout the state that are working to expand support, and we have educators that offer programs. They're about 1 to 1.5 hour long programs that we offer at senior centers, hospitals, anywhere within a community, you name it. And it is about topics such as know the 10 warning signs of Alzheimer's disease, or effective communication strategies for caregivers, or understanding and responding to dementia-related behavior. And I'm going to show you in a moment how to find the education that is available in your community as well. But in addition to education, more and more early stage programs are popping up across the state. An example of one early stage program is one we are starting in Billings in partnership with the Yellowstone Art Museum. It starts actually tomorrow, the 20th of September. And it will be the third Friday of each month from 10:30 to noon. It's a free program for people in the earlier stages of dementia or just cognitive changes in general. And we highly recommend that their family and friends join as well. And we meet at the art museum. We have a time where we look at a specific exhibit and spark conversation and connection around that. And then the second half is going into the studio and creating art. It is not as much about the art. It is more for us just to get together, to socialize, and to connect. We want people to feel less alone in this, and continuing to have them part of our communities and cut down on isolation that can occur. And people do not have to be good at art to participate in something like this. This same type of program is happening in Missoula. There are memory cafes that are early stage groups as well, where you just meet at a local coffee shop or other public space, and we bring together those individuals living with cognitive changes in their family, and there's some sort of activity that month that spurs connection and conversation. So there's one of those in Bozeman, in Missoula, and other places in the state as well, and I will also show you how to get to what is in your area in a moment. Last are support groups, and those are available across the state, mainly for caregivers at this time. To find the resources that are available, so the educational programs, support groups, and early stage programs in your community, we have a community resource finder, and all you have to do is go to this link or type in community resource finder. Go to programs and events, and I'm actually going to show you on my screen, hopefully. There is, so if you go to Community Resource Finder, you click on programs and events, and let's say we want to find out about educational programs. You just click that box, and you can search by zip code. So if I want to find out what's happening in Billings, type in the zip code and search, and it brings up the programs we have going on at the VA outpatient clinic here in Billings, and some other opportunities as well. You can also go in and expand this search by miles. So we can even search by 500 miles and see what's available as well. You can also go in, and this is where you can find those early stage programs. We can search that and find that the Art of Memory, the program at the Yellowstone Art Museum, is listed in here too. And support groups are also under this tab as well. In addition to that, under the Community Resource Finder, you can see that we are partnering with AARP on this resource. So their programs and events can be found in here. You can find community services that are available, housing options, medical services. If you are from any type of organization under one of these headings, and you go in there and you can update your information if need be as well. And my contact information is at the end if you have any questions about that. Continue on. There are many online resources for individuals living with dementia and their families as well. At alz.org, there is a plethora of information out there. I highlight a few that we hear most often as being helpful for families. One of them is our Alzheimer's and Dementia Caregiver Center. So caregivers that want to go in and find out about communication, or my loved one is having symptoms of sundowning, how do I approach that? There's all sorts of information there for them. ALZ Connected is another resource out there online. This is how Bonnie, who was quoted at the beginning of the presentation, actually got connected with us. ALZ Connected is really an online support community, sort of a message board. So individuals living with the disease can go in there and connect with others that are living with it, maybe put out a question or concern that they're having, what they're dealing with, and family caregivers can do the same. So it's a great way for individuals that maybe don't want to have that in-person connection, but still want to connect with others. They can do it through that. We all know that the topic of dementia and driving is one of the most challenging topics. We have a whole section of our website devoted to this. The staff at the 24/7 helpline can also help families navigate the discussions around dementia and driving. There's some nice videos on there as well that give families an idea of how others have had that conversation. And the last one listed here is the Alzheimer's Navigator. What this looks like is families can go in and enter basic information about their situation, and it pulls up a step-by-step list of it's kind of an online care management, a step-by-step list of things they should be thinking about. So it helps families realize I need to be thinking about legal and financial matters. I need to be having conversations about if my loved one isn't safe at home, what's the next step? That is all available out there. We have an endless amount of brochures and topic sheets that are available as well. We are always happy to get you information that you need within your organization, or if you're working with a specific family, we're happy to get that to them. We have information about communication, about behaviors, you name it, we will have a topic sheet about it. It's hard to say, but the holidays aren't too far away. We have information to prepare families around the holidays. Really anything you're looking for. Moving into efforts supporting providers specifically, I will navigate us. We have another section of our website that is specifically tailored to our professionals. So if you just go to alz.org, there's a tab at the top that has professionals on it. Simple to navigate to. If you're within a health system, a clinician, you can go to this section and it will give you more information about cognitive assessments, dementia diagnosis, care planning, even how to support the individual if they have insight into their disease, and a lot of downloadable resources as well. We have CME courses available too, and they're all around challenging conversations about dementia. How do I have that conversation with the families that don't want to, they're always looking for a second opinion. How do I have a conversation with them? How do I have the conversation about dementia and driving? Just those difficult, challenging situations you can run into. These are free. There's 5 modules. It's only about 75 minutes long. It's not a tremendous time commitment there. Another available resource is Project ECHO for Alzheimer's and dementia care. This is available for primary care practices. And maybe you're not part of a primary care practice at this time, but perhaps you know one and can spread the word about this support that's available. We need to have a clinician that is part of it, but if the clinician is part of it, then any other care provider can also take part in this Project ECHO. Project ECHO is a way to connect our clinicians and providers throughout the nation, actually, via, I believe they use Zoom, so through video conferencing. And they're hour-long sessions that are bi-weekly and over the lunch period. And we have clinicians that really focus in and are experts around dementia that'll do more of the didactic experience, and then it's more case study focused. So if you have specific cases that you're working with, you can bring them to the table and have a discussion around that. There is currently a session going on, but there is ongoing recruitment for Project ECHO. And our next one will start again in the spring. They're thinking either March or April. So please contact me if you have any questions or are interested in that as well. If you are a clinician, we also have cognitive impairment care planning toolkits that walk through what that diagnostic process can look like. That can be found on the website we were just at. There is also a care planning code available that physicians, physician assistants, nurse practitioners, clinical nurse specialists, and certified nurse midwives can also all bill under this code. And it's to help give more time to doing that diagnosing and care planning with the family members as well. Please be aware of that and the resources that are available around the care planning code. If you are technologically inclined and like to be on your phone, we also have a mobile app that's available. It might just be neat for you to download that and see what's available on there as far as resources. It helps you navigate to your local Alzheimer's chapter. That would be us here in Montana. It's just a nice, it's in your hand way to access resource and guidance as well. If you're particularly interested in research, there is a whole section of the website around research. We have an e-newsletter. There's a journal around the latest research too. We do convene an international conference around Alzheimer's disease research, and that usually happens in July, but it's a very hopeful time when we bring together scientists and researchers from across the world to talk about the latest. And to finish up, again, the 24/7 helpline is available for any of your questions, and I am always here too. My email is on the slide, and I'm sure we can send these out, as well as my phone number. We are always happy to answer questions, help navigate if you have ideas on how we can better support the individuals that you're working with. We're always open to that.
Thank you so much for joining us, and I will be sending out a survey in the next couple of minutes to everyone that attended. We'd really appreciate it if you could take just a few minutes to fill that out. Thank you so much to Whitney for hosting this great webinar. I definitely learned a ton about the Alzheimer's resources, and we really appreciate having you. Thank you so much.
Thank you so much.